Hi, this is It Takes a Village with Dr. Carrie, and we also have
Dr. Michelle.
And I'm Julie Wattenberg. I'm a pediatric physical therapist.
So tell us a little bit about what that means, Julie.
So pediatric physical therapist works with children from 0 or less than 0 if they're preemies to 21 years old, usually with developmental delays or orthopedic conditions that are more pediatric based.
Okay. So we know that things like movement is such a big deal because it helps develop the brain, but from your perspective, from your lens of being a pediatric PT, why is movement so important? Why do parents need to be aware of this?
So movement is really important because it obviously is really important for the child to learn how to integrate both sides of their body, how to learn how to integrate the front and the back of their body. It's also important, obviously, for our digestive system to have everything, your core moving so that your digestive system is moving. There's a lot of kids that I see who have significant constipation because they're not moving as well. They're not rotating their pelvis. Movement is also important for your chemicals in your brain that make you help you to feel good. And we have a lot of kids who aren't moving as much as they should. So if they're not moving as much as they should, if they're not moving as much as they should, and they're having trouble moving, then it impacts their ability to move later as well. And I think that, intervening early is where that's important.
Yes, so what happens now can impact future development and function. Mm-hmm. What are some things that parents can be on the lookout for? Because there's so many things on the market, and I think parents are just overwhelmed with all the latest and greatest gadgets and devices and things like that. You had an interesting perspective that you share with your clients.
Mm-hmm. So one of the things that I tell my clients is just to avoid containers in general. So a container would be like a bouncy seat, a swing, a car seat as much as possible, a bumbo seat, any of those containers. They do have their place. They do have a purpose, but they shouldn't be used all the time. One of the things that I often tell my families is that to use the TVS rule. So that means whenever you place a baby down, you find a safe place in your home. If you have dogs, you make sure that it's a safe place away from the dogs. Or if you have toddlers, you can have a safe place away from toddlers. But you do want to place your baby on their tummy first, so T, their back second when they're getting tired, B, and then S would be their swing, or if they're older, in a sitting position. What happens often when children are older is parents stop putting the baby on their tummy because they feel like they can sit and they can now be more functional when they're sitting, but that's actually not true. We need the baby to move as well, and they need all those skills when they're
so always go in that order until they kind of get tired, and then kind of graduate them up.
Yep.
Okay. Interesting.
Yeah, I know bumbo seats is a big thing that we talk about, and because as you mentioned, it stifles movement, and movement is good brain food, and it's important for hitting those neuromotor developmental milestones. And so with bumbo seats, anytime
you're just like this the whole time,
yeah,
just try to breathe when you're like that. That's really hard to do.
Yeah, just forcing them to be in a position that developmentally they can't do on their own can actually cause more harm than good. So that's one of those things, moms and dads, if you are gifted one of those things, I'm not even sure how to recycle or dispose of it, but not a fan from a pediatric PT standpoint.
And a chiropractic
standpoint.
All the rest of the board.
Yeah. Anytime you're putting a baby upright against gravity in a position that they can't control, it's bad. So for example, even those elevated surfaces that babies sleep on, there's a name for it, but even the elevated surfaces that babies sleep on, if you don't have to elevate your baby, you shouldn't elevate your baby because they can't necessarily control their spine and their head. And so what happens is they often fall to one side over and over and over again. That causes tightness in one side of the neck, or they're constantly falling to one side and rotating their head, which is causing flatness in the head, which is causing them to not be able to rotate their head to one side or the other. The other thing about containers that's really important is it doesn't allow the baby to move out of that physiologic flexion, especially for the infants that they are stuck in when they're stuck in utero. So when they come out of utero, they need to be able to move and elongate all those muscles that are tight. That elongation of those muscles that are tight actually helps them to integrate some of those really important reflexes that are allowing them to help with movement initially, but later on we need to integrate those reflexes. So lengthening through the entire sternocleidomastoid muscles, opening through the chest, opening through the hips, opening through the hamstrings. All that is so important, but when you put a baby in a container or a seat for a long time, we're not allowing them to lengthen those muscles that are so important that allow them to move freely.
That totally makes sense. What are some of the big reasons like parents will bring their kids to you? Are there any like major things that you tend to see?
So often I will see babies who are referred to me because of any genetic reason. So someone who is already diagnosed with, say, Down syndrome or something like that. That would be one of the very early reasons. Another very early reason why I would see someone is if they were a former preemie, significant preemie. They need someone to help them to integrate their movement patterns because they were born a little bit too early, and they need someone to help get their movement patterns equal on both sides and front and back. But then later, one of the most important developmental milestones is independent head control by 3 months. So we need to make sure that if the baby doesn't have independent head control by 3 months, that is a really, really big red flag, and you really should be referred to a therapist. Another reason is at 4 months, you should be able to see both arms and legs equal. So if you notice at 4 months that we're always using one side and we can't use the other side, it's really important to be referred for a therapist. Later milestones would be if we sit at 6 months, which is super, super common, but we can't move past that. That a lot of times means that we're not really sitting, we're actually stacking our body parts right on top of one another, but we don't have enough muscle control to laterally move and transition. So a lot of kids will get stuck. They'll sit at 6 months, but they don't move and progress past that by like 9 months. If we're not moving in through space by 9 months, so we're not rolling or belly crawling or anything like that, that would be another referral. Later, walking if you're not walking by 15 months. So again, if you're meeting all these milestones, but then you don't hit that next one, that might be your next flag. If you are walking, but you're up on your toes, that would be another reason why kids are referred. Then later reasons would be just kids who are walking, but they're just really falling a lot. So that would be like the 2-year-old that just doesn't have very good balance. That is another reason why kids are referred. And then later at school age, kids who are referred are often clumsy or uncoordinated for whatever reason. Some of these things could have been seen earlier, but it's okay if it wasn't. You still can get in. Yeah. You still can get therapy, and we can help work on those muscular imbalances or transitions.
This is why birth does matter, and the prenatal period. And, from our lens, we're looking at balance in the pelvis so that the baby has plenty of room to grow and develop. But sometimes birth is tough. Sometimes there's torticollis. You had mentioned, I'm glad you mentioned like the flattening the head, because sometimes we'll come across families where they're like, oh my gosh, my baby's been holding their head up since a week old. Look how strong they are. And for us, that's the red flag that there is a lot of neurological stress that's been locked in. And it could have been from birth or how they were positioned in utero. But, we're born, we are in utero in flexion, and we're supposed to grow into extension. So if they're having these issues, they could be rubbing bald spots on their heads because they're such in a state of fight or flight that they're just kind of locked in. And so, I know in the past they used to think the flattening, what they called plagiocephaly, was just more of an aesthetic thing. But we now know it affects so much more.
It impacts movement significantly. So the plagiocephaly, if you have a flattening on one side of the head, you have trouble the baby's not going to go necessarily through the extra effort to get up and over that hump. So what happens is they continue to lay on that same side. And it's not just the head, it's the entire body. The baby moves from their head. So if they're not moving their head to the other side, then we're not developing the visual skills to the other side. They're not developing the writing responses they're supposed to the other side. Their eyes may have difficulty converging later, which would be difficult for reading. There's so much more that goes into it than just the head. You know, the other thing that we want to make sure that we look at is whether or not a baby has, if they're not moving symmetrically, that impacts not only the muscular development, so if the baby's always using one side more than another, but it's also the neurological development. So babies are born with exuberant projection. So if they're always looking to one side and they're always using the same patterns over and over again, those muscular patterns are strengthened neurologically because the muscle connections and the brain connections are strengthened and the other connections that aren't being used are pulled out. So not only is the baby muscularly strong to one side because they're using those muscles within the muscle, but they're also neurologically stronger in those motor patterns. So when we're neurologically stronger in those motor patterns, that means that we actually don't have as much firing to fire and use those muscles.
You're speaking our language. I mean, I'm just like nodding over here, like, because we're all like neurological, like we need that input going to the body, whether it's your muscles, whether it's your digestive system, what have you. And, you know, this is why like we work so well together, is we're making sure that neurology is firing the way that you should, and then you integrate it into like those repetitive movements, the muscle tone. Right. So it's just clear that way.
Yeah. And I often, I'll often get kids who have reflux, and parents are really concerned about their movement patterns. They're arching, they're extending, they're looking to one side. And I think they should be concerned about it. And it looks like they might have a neurological issue. And whether or not it's just reflux or it is a neurological issue, we need to work on that, because if we're always extending and arching, you have to think about later, how does that impact their ability to fall forward? If we are always arching and extending, when we fall forward, we're going to use the muscles that are first most neurologically and physically available, and that's going to be the extensors. So we end up hitting our head, and that's, those kinds of things is what I look at, and why therapists sometimes can be a little crazy when we look at movement, because we are always projecting to the future.
No, and I think that's key. And this is why it takes the village, because we know that if some of these softer signs get missed, maybe by the parent or the practitioner, it's not that these kids necessarily grow out of stuff. They're just growing into more complicated things down the road. So we're very grateful to know people like you in the community, because it really takes all hands on deck, especially with kids that are born today, because they're born under a lot more stress. Moms have been under more stress, and then that just follows them. So we just wanted to say thank you so much for meeting with us and sharing your knowledge base. And we hope that the moms and dads out there were able to pull definitely more than a handful of nuggets out of this. But please reach out. We want to be a resource for the community, and this is someone that you need to seek out. So
thank you.
Take care, guys.
Bye.